Hello, my name is Kate. It's nice to meet you all through Zoom. I am a medical student at Brown University, and today I'll be presenting about respiratory health. I want to thank Allie, another medical student with who I made this presentation. Allie, do you want to say hi?
Hi, everyone.
Yes, Allie presented in Spanish earlier today, and I'd like to thank Rosa for making today happen. So the goal is to give you knowledge and vocabulary to communicate with healthcare professionals about the health of your lungs, which is very important to your well-being and your quality of life. We'll start with talking about what respiratory health is. So respiratory health refers to the health of your lungs. A doctor who specializes in respiratory health is called a pulmonologist. Often when you go to see a pulmonologist or your primary care doctor, any doctor, when they check your lungs, that's when they place the stethoscope at different places on your chest and ask you to breathe deeply. Just as the lungs are an important part of your everyday life, so is your respiratory health. So what do your lungs do? Your lungs are responsible for giving your body oxygen so that all the tissues and organs in your body have the oxygen that they need to do their everyday functions. Blood from your heart passes through the lungs, where the blood will give up carbon dioxide and pick up oxygen. The blood that now has the oxygen will be pumped to the rest of your body, all the way to your fingers and your toes. So, when we talk about breathing, you breathe in oxygen, which is known as inhalation or inspiration. You breathe out carbon dioxide, which is known as exhalation. This process is called gas exchange, which is what this illustration shows happening. When we inhale, oxygen enters the lungs, it travels through the nose and the mouth, down your throat essentially, to the lungs, where oxygen will replace carbon dioxide in the blood. When the blood releases carbon dioxide, it travels up your airway, so when you breathe out, that's when the carbon dioxide comes out. Lungs are like balloons, meaning they're compliant. So they'll fill with air, so they change shape when we inhale or breathe in. They'll fill with air and get larger. They're also elastic, so that when they return to their original shape when you exhale or breathe out the air. So what are the symptoms of lung problems? And by this, I mean, what questions would a pulmonologist or another healthcare professional ask that might tell them about your lung health? Saying yes to these symptoms could be signs that there might be an issue with your lungs. Some common symptoms are cough, mucus. Don't be alarmed, a healthcare professional may ask you what color is your mucus to try and understand if there's infection or not. Wheezing, and wheezing sounds sort of like a whistle, and it can be heard more clearly when you exhale. And then shortness of breath, either at rest, having a hard time breathing, or especially with activity. So those were the signs that there could be problems with your respiratory health. Problems like what these signs could point to are problems that include asthma, which we'll talk about a bit later, COPD, which is chronic obstructive pulmonary disease. So this means the lungs are inflamed and it's harder for air to flow. Types of COPD, emphysema, which is a lung condition that causes shortness of breath, or chronic bronchitis, which is, since it's part of COPD, it's also inflammation. This is really common among those who smoke cigarettes. And so people who have chronic bronchitis may get more infections of their lungs. Lung cancer is also a very serious disease. Again, this is also frequently associated with cigarette use. And I talk about this is why many doctors will ask you if you smoke and try and help you quit. And then COVID-19, which of course is a lung problem that is pretty on our minds right now. So there are ways you can keep track of your own respiratory health. If you want to monitor your lung health, there are some basic devices that you can use. I'm going to talk about two devices. Both are relatively inexpensive and usually available at your local pharmacy, at Walmart, at Target, online. One way of monitoring your lung health is using a pulse oximeter. This tells you how much oxygen is in your blood. So it usually measures, so it's looking at the amount of oxygen in your blood, and the number that you want to see is more than 95%, because that's 95% oxygen in your blood is how much you need for all your tissues and organs to have the oxygen that they need. It's important when you're doing this, it's on your finger, that you are calm as it measures the oxygen in your blood. And if you do get a number that is less than 95%, you should see a healthcare professional. So another way to monitor your lung health is using a peak flow meter. This measures how well you push the air out of your lungs. The normal range will depend on your age, your sex, and your height. You could find these ranges online, but it also would be great and more important to talk to a healthcare professional about what's the right range for you. These devices are actually more affordable, so it's a really good way that you could keep track of your lung health. So now we're going to talk a bit more about asthma, which, as I touched on, is a lung problem. Asthma is a significant problem in Rhode Island due to many factors, which are both environmental and socioeconomic. Asthma makes it harder to breathe because the lungs tighten up, which is like the balloon we talked about earlier, just getting smaller, and the airway is smaller and restricted, particularly in an asthma attack. And so that means that people will have a harder time breathing, and it can feel difficult to breathe. And to compensate for that, people may start to breathe really rapidly in an asthma attack, and they could also cough or wheeze. Asthma often starts in childhood, but it doesn't go away. It is what is known as a chronic disease. It can, of course, be managed well and taken care of throughout your lifetime. So what can make asthma symptoms worse, which is when we talked about really having a hard time breathing, which can be really rapid breathing, are triggers. And asthma has triggers that often relate to our daily lives. Here on the side, I have a fun little graphic that shows the triggers as comic book villains. I did want to note that the resources that I found for asthma are often geared towards children, since that's when the disease will often begin in childhood. Like these comic book villains, there are three main categories of triggers. First, you have allergens, which are like dust mites, pet hair, mold. You have irritants, which can be cigarette smoke or air pollution, and you have aggravators, which could be exercise, cold air, or being sick. And it is important to avoid triggers if you or someone you live with or someone you love has asthma. So the air we breathe can harm our health and worsen our asthma symptoms. Asthma can be hard to manage in adults and children who live in poverty due to increased presence of the triggers. What I mean by this is there are housing conditions that contribute to breathing issues, which can include peeling paint, mold, dust mites, secondhand smoke, pests like cockroaches and insects, even rodents, having other pets at home, and any other animals. And these can be triggers, and these can make it harder to breathe in your own environment. So in Rhode Island, Black and Hispanic children are more likely to visit the emergency room or to be hospitalized due to asthma. So resources for the Latino community are necessary. In Rhode Island, there are asthma resources that are really helpful. Here we have two major programs. The first is called Draw a Breath at Hasbro Children's Hospital. It's asthma workshops for children and for their parents to learn how to manage the child's asthma. These workshops are held in local community settings in Rhode Island in both English and Spanish. And then the second program I have here on the screen is the Breathe Easy at Home program. This is a pretty collaborative program. It's run by the Department of Health, and it brings together important groups to help create trigger-free housing. So it gives people with asthma and their healthcare providers, and then the Rhode Island Department of Health, the individual city or town, and the landlord, all those stakeholders come together, and it's a chance to work together to improve living conditions in the home. The changes that are made will reduce exposure to asthma triggers and help children with asthma breathe easier in their own home. So another lung problem that I listed earlier, and I definitely want to circle back to, is COVID-19. A study published this year found that during the pandemic, infections rates with COVID have been consistently higher in the Latino community here in Rhode Island. The paper touched on some factors that could contribute to this higher rates, such as lack of access to medical care or COVID testing, or lack of health insurance. Among the Latino community, there are generally fewer opportunities for social distancing because of more multi-generational housing or multifamily housing. And in addition, many people in the community might have worked as essential workers for economic reasons or work reasons. So they had to continue working in the face-to-face environment during the pandemic. And they also related this higher risk of transmission could also be related to higher disease prevalence. Either way, when we talk about COVID, there is this concern for long-term lung damage. There's not enough known yet. So what I want to say is, in the meantime, for those who had COVID and just generally for all of us, it's really important time to monitor your health and nutrition, to take care, to eat healthy, to eat a healthy diet and exercise as often as you are able to, aiming for 150 minutes a week. Take your medications and stay up to date on all your vaccinations. And of course, I do mean the COVID-19 vaccinations, but also this coming fall and winter to get your flu vaccine. And if you're in the indicated age group, and your doctor will tell you this, to get your pneumonia vaccine and to call your doctor if you have any questions about these vaccinations. We just really need to take care of ourselves now more than ever. So with that note, Progreso Latino also has a COVID-19 support team. I have Rosa's contact here listed on the screen with a phone number and an email address for support during this time. And that does bring me to the end of our respiratory health presentation. I hope this gave you some knowledge and vocabulary to make sure that you're taking the best care of your lungs. And I really want to thank you for your time. Please reach out to Progreso Latino if you have any questions, and I would be happy to follow up. Thank you.